Guys, we'll be talking about the positron emission scan as a diagnosis modality. So now, we've been making so many videos on diagnosis modality, and I told you guys that diagnosis modality is basically like instruments in the hospital that are helping you verify for a diagnostics. Okay, so now positron emission tomography. How can the positron emission tomography be able to help you verify a diagnostics? Okay, so maybe, for example, if you suspect that, okay, this part of the body has this disease condition, all right, how can you verify that this disease condition is actually there? All right, so you might go into using some instrument to check the internal environment of the body and all that. All right, and PET scan is one of them. So you can see on our screen we have CT scan, we have PET scan. All right, now basically CT scan is the black and white, while PET scan can actually show you all those colors and you like it. All right, so CT scan, the full meaning is what? Computed tomography, while the PET scan is positron emission tomography. So how can you use a positron emission tomography to actually um, verify your diagnostics? All right. So now the PET scan has its primary use in the field of oncology, and it utilizes radiotracers for measuring various metabolic processes in the body. Okay. So now various changes in metabolism, blood flow, regional chemical composition can be measured using the positron emission tomography. Okay, so this is how the positron emission tomography machine looks like. And okay, they send the patient the part of the body that you want to examine, you send it there. Then next, the scan is out, and the scan has several colors. All right, and people who have been trained to use the positron emission tomography will know what these colors mean. All right, so now positron emission tomography, let's talk about the uses. It is used to access myocardial perfusion, okay, and viability study. Okay, in epilepsy, it is used towards localized temporal lobe epilepsy. All right, to know the exact place that is affected by epilepsy, you could use the positron emission tomography. Then in cancer imaging, you can use it in imaging of the cancer lungs, right? To know which part of the lungs is actually down with the cancer. All right. Then also the colorectal cancer, you could use the positron emission tomography to know about the exact condition of a colorectal cancer. Then in melanoma conditions too. Then head and neck cancer and breast cancer too, you can use the positron emission tomography. Then musculoskeletal tumors. If you have any musculoskeletal tumors, you might opt in for the positron emission tomography test to verify this. All right. Then thyroid cancers too. Okay, you can use the positron emission tomography to verify if this thyroid cancer actually exists. Okay. So guys, this is it about the positron emission tomography as a diagnostics modality. Hope you guys enjoyed this tutorial. Stick with us because we'll be studying so many flips of positron emission tomography images. All right, so that's it.